every time that we share our stories, we are helping someone else who is suffering in silence. My name is Kayla Lauriano, and today I'm going to talk about what it's like to experience a pregnancy loss. What motivated you to share your experience and work with other women who have experienced pregnancy loss? How has this shaped your own experience? In 13 years of being a labor and delivery nurse, I've cared for hundreds of moms and parents who have experienced this loss. And over the years, I've been very active in the bereavement committees for all of the different hospitals that I've worked in. And I've offered my photography skills to moms or parents that have experienced this loss so that they can to capture the little time that they have with their baby. And it's through their experience and their sharing with me that I was able to learn how to be a better support person and how to hold space for them that has motivated me to share my experience. How did you discover your pregnancy was ectopic? I took a pregnancy test on Christmas, and a couple of hours later, I started having some spotting and some cramping. I was aware that that is something that is common in pregnancy, although not normal. When we went back to the hospital on this day, it was on New Year's Eve, all of the labs were closed. And so I called one of the OBs that I work with, and she had advised me to go to the emergency room to get my labs drawn, and that she had suspected that I might have an ectopic pregnancy. That hadn't even crossed my mind. I thought that I was going to lose the pregnancy, but an ectopic hadn't crossed my mind at all. What is an ectopic pregnancy? An ectopic pregnancy is when the fertilized egg gets implanted in somewhere else within your body other than the uterus. In most cases, the fertilized egg is implanted into the fallopian tube, which is what happened to me. Ectopic pregnancies are the leading cause of maternal death in the first trimester of pregnancy, and it happens in about 1 to 2% of all known pregnancies. What were your treatment options? So the two options are to get a dose of chemotherapy called methotrexate. It's a low-dose chemo, and it's an injection into your muscle, or to have surgery. My partner and I discussed what we should do, and we decided to go with the least invasive treatment. So I chose to do the methotrexate shot. So I got the shot, went home, and a couple hours later I had a really bad allergic reaction to it. I wasn't able to eat for 3 days. It was really miserable. Then 2 weeks later, even though my labs were trending in the correct direction, my fallopian tube ruptured while I was at home. And so we went back into the emergency room, and within 10 minutes, they had me in the OR for an emergency surgery to remove my fallopian tube. When they got in, they noticed that I had already been bleeding internally. So it is a life-saving measure that was taken at that point. Did you feel any guilt surrounding the loss of your child? Yes. For obvious reasons, it happened in my own body. So it's kind of natural to think of all the reasons of why it may have happened. You know, did I not exercise enough? Did I exercise too much? Did I work too much? Was I too stressed? Whatever it may be. And I think all of that is a result from the societal expectations and the taboo topic of pregnancy loss and miscarriage. I've noticed, though, in the last 5 or 10 years, people are getting more comfortable with sharing their stories, and it's really beautiful to see because so many people experience this type of loss. And every time that we share our stories, we are helping someone else who is suffering in silence. You're no longer pregnant. You don't have the baby with you to hold. And if you told somebody, then it's like, well, why aren't you pregnant anymore? Or if a lot of women, especially specific to miscarriage, don't tell anyone that they're pregnant, and then they lose their baby, and then they are like literally suffering in silence. They don't have anyone to talk about their experience with. So I hope that within sharing my own story that it can motivate you to share yours, whether that's with a loved one or a therapist, or anyone who you identify as being a safe space. How do you feel about the term miscarriage versus pregnancy loss? I feel like neither of them capture the amount of despair that you feel after your loss, because it's not a loss. We didn't lose our babies. They died. So they don't really capture like the essence of what it feels like to experience that. But they're commonly used, and I think because they're easier to say. And they don't make people feel so uncomfortable. Saying my baby died feels very uncomfortable to the other people that are hearing it. What has your healing journey looked like? My healing journey has looked like a roller coaster. Emotionally, it has been a nightmare. Very like up and down. The first 3 months were probably the darkest days of my life. But with therapy and a really great emotional support system, I've been able to make it. Every time a milestone passes, like 24-week viability, or this is when we were supposed to have a baby shower, or most recently my due date passed, it tends to get really dark again. Did you receive any well-meaning but negative support from your network? Yes. This is something that I'm very passionate about because as a labor and delivery nurse, I have cared for many women who have had pregnancy loss. So I've learned over the years what are some things that we think are really nice to say after a death, but really are very harmful. Some of the things that I've personally received were, at least you didn't die, which maybe that made that person feel better, but it didn't make me feel better. Anything with at least really is just not a good way to go. Another one was at least it happened early. Another thing is people that say like this is in God's plan, or everything happens for a reason. And while those seem well-meaning, they're very harmful for the person that is experiencing the death and the grief. Instead of making a comment, if you're not sure what to say, you could just hold space for that person, ask them how they're really feeling. It's really special when people remember my baby and different milestones. So put it in your calendar. If your loved one is experiencing a pregnancy loss, put it in your calendar when their due date is or when the birthday of the baby is, because usually by that time everybody has forgotten. And so to be a support person that remembers is so incredibly touching, and it reminds us that our babies meant something.